Well, hello. My name is Dr. Stephen Child. I'm the Director of Clinical Training and a General Physician here at Auckland District Health Board. I've been asked to do a short little video and welcome you to Auckland, which is probably sounding strange in a Canadian accent. I've been here for 23 years and I've learned a little bit about the differences between the New Zealand system and the Canadian system, but I wanted to teach you a little bit about what it's like coming from the UK system. I think probably one of the biggest differences you'll notice is the ethnicity mix here in Auckland. We have approximately 25% in total between our Maori population and our Pacific Island population, and we have 25% Asian population in Auckland, and therefore there's a broad ethnic mix. Maori have a particularly high incidence of cardiovascular disease, but also an extremely high incidence of diabetes. A lot of that is due to the fact that from the obesity standpoint, we're second only to the UK actually as the most obese nation on earth. And because of that obesity, we have a high incidence of hypertension, diabetes, renal failure, and gout. Maori have 5 times higher incidence of gout than in other illnesses in other countries, and therefore they're a very prevalent disease here. From the cultural viewpoint, you'll be getting some talks about the Treaty of Waitangi and about the Maori as the original people, and essentially what that means on how we deal with their culture as the original indigenous people. The Asian culture, as I mentioned, however, is also very prevalent in the Auckland system, and they too have differences in the way that they like to be approached by their doctors. One of the biggest differences with the Asian population is that often you tell the family what is happening with the diagnosis rather than telling the patient themselves often. But these are the sorts of things that you'll pick up while you're here. Apart from that, there's not too many differences. I did an elective at the Mayo Clinic and I've also worked in the UK, and it always strikes me how human nature and human illnesses is broad and worldwide. It doesn't really change where you come. You'll get COPD, heart failure, pulmonary emboli, DVT, cellulitis. Everything is the same as what you'll be used to in your home countries. Small nuances. We have a very computerized system here in New Zealand. In fact, a study recently showed that our GPs have the highest percentage of GPs that are fully automated. So we have an automated clinical record. All x-rays are automated, all lab results are automated, and in fact our dispensary service now in the Auckland region is also integrated into the computer system. So by going into our computer system you can see what medications have been dispensed anywhere at any community pharmacy throughout the Auckland region, which is fantastic. We don't yet have an electronic health record. We do scan the notes in, so the past notes are available through the electronic system, but it's not the same thing as a single electronic health record. We have treatment guidelines. We have an RMO handbook to assist you in our usual treatment protocols, and have a fairly high-tech approach to our medical treatment. Investigations and treatment, MRI scans are available as an inpatient, usually within 2 days. CT scans are usually available the same day, ultrasounds the same day, etc. And so as an inpatient, our accessibility to many investigations is actually quite good. As an outpatient, unfortunately, the waits are a little bit longer, but I think a little less than what you're experiencing in the NHS. For example, a CT scan as an outpatient, a CT scan of the abdomen as an outpatient is probably about 6 to 8 weeks. CT scan head as an outpatient or to see neurology as an outpatient is probably about 2 to 4 weeks kind of thing. Surgical waiting lists are the same worldwide. We're trying to get our waiting lists and first specialist assessment under 6 months and are achieving that in most instances. So I think you'll basically find that it's a very similar system to the NHS. I hope you enjoy yourself. Remember, it is the practice of medicine, but also this is the stage in the career, particularly when you're here to have fun, explore the rest of New Zealand, explore the differences in practice between the two cultures, and hope you have a great time when you come here. Welcome.